Hello everyone, this is your host Rohan Tandel from InnoHEALTH Magazine Studio. I welcome you to this podcast produced by Innovation Careers with a mission to spread awareness and knowledge of various facets of healthcare innovation. This podcast is the third chapter from the 8th edition of the virtual IC Innovator Club meeting hosted on the topic Transformation of Indian Healthcare System Post-COVID, brought to you by InnoHEALTH Magazine, the first magazine in India on healthcare and innovation. The topic of this podcast is What We Can Learn from Developed Economy, composed and narrated by Dr. Shiban Ganju.
My name is Shiban Ganju. I've been invited to talk on what India can learn from the developed economies regarding healthcare post-COVID. I will keep my comments brief, limited to 10 minutes. I want to dwell on 4 important points that we can learn from the West. Number 1 will be increase spending. Number 2 will be building infrastructure with the healthcare expenditure. Number 3 will be work on the demand side of the healthcare system. And number 4, improve purchasing mechanisms to buy services from the providers. These are the 4 areas where West is far ahead of us, and we have to learn from their experience, which started somewhere in 1883 with Bismarck in Germany. So we have close to 150 years of experience in the world of healthcare and how to organize it. And there's considerable information out there that we can adopt. Now, Indian healthcare expenditure is one of the lowest in the world. According to WHO, we spend 3.54% of GDP. This data is from 2018. This includes both private and public spending. The public spending is close to 1% and rest is the private spending. Now 3.54 even in aggregate is one of the lowest in the world. The least developed countries on average spend 4.02% of the GDP. Lower middle income countries spend 4.09%. European Union spends 9.85 on average of GDP, and US spends close to 17%. Our per capita expenditure in India is $73 annually, which and a purchasing power parity is about $275, and the US is $11,000. With this vast gap, it's quite obvious that we cannot provide the world-class advanced healthcare. So the first important thing is we have to increase the investment in healthcare. It has been agreed upon by all the governments that have come in the past 20 years. Everyone in their healthcare manifestos and healthcare plans have promised to increase this expenditure to 2.5%, including the current government, but it's yet to happen. With this increased expenditure, then we'll be able to match some of the standards of other advanced countries. While matching the standards, it's also important to learn from how they have managed to come to the level that they are at now. Along the journey of their expansion of healthcare and modernizing healthcare, a lot of good things have emerged and a lot of mistakes also have been made, inadvertently though, which we can learn from. Since this topic is for post-COVID healthcare transformation, first proper use of this investment would be building infrastructure. Building infrastructure would include hospitals where they're deficient, especially in rural areas and hinterland of India, buying modern equipment for the hospitals, and creating management IT infrastructure, which incidentally is extremely important with this massive investment. Without a backbone IT infrastructure, there could be a lot of wastage of investment. Now we could invoke a public-private model that if the public money were utilized to build the infrastructure, that is building hospitals and buying land, and the private participation could bring in equipment, manpower, management, and operations. The government could lease this building and land to the private partners for extended period of time, let's say 30 to 60 years. In my rough calculations, I've seen that the GST, taxes on the employees' benefits, and equipment and supplies would generate enough tax revenue for the government to retrieve its investment anywhere from 15 to 30 years. So this could be a functional model of investing money. As COVID experience has shown us, we are woefully deficient in infrastructure. Number 3 on my pointed list was improving the demand side of the infrastructure. Demand side means population health. The healthcare structure all over the world is designed to improve the supply side, which goes only to that extent of removing preventable disease. We have to work and invest in demand side of population health to prevent what is preventable. This requires minimal investment. A mere 15 to 20 rupees per capita per year would be sufficient to do social behavior modification and improve some of the social determinants for population health to prevent disease. As we've seen in COVID, the demand side of this equation is as important as the supply side. If people did not aggregate in groups and would not miss using a mask during gatherings, would wash their hands frequently, and generally quarantine themselves to prevent exposure, that will go a long way in as much as vaccination, hospitalizations, and therapies for COVID would do. In fact, the population health measures of demand side are far more important in COVID and many other similar diseases, and it incurs much less cost than the supply side solutions of vaccination, drugs, hospitalizations, ICUs, and ventilators. So we should work on demand side of healthcare with this investment. Now, having said that, with this massive investment, we also have to ensure that the services provided for the population are properly paid for. There is a chance of lot of pilferage and also inefficient, ineffective usage of investment unless we have our act together and how to purchase services from providers. If there's one area where the West is still struggling, it is this. We do not have a perfect purchasing mechanism of services. Just merely throwing money and hoping it'll solve a particular problem of healthcare is not going to happen. And that's why the IT infrastructure is important. In this model of expanding our services to the hinterland, it's important that every penny that is spent wisely. Otherwise, the cost of healthcare goes sky high and nobody can afford it. The providing mechanisms are all detailed in many countries. It can be bundle payment, cash for payment, co-pay, gateway mechanisms, outcome analysis, payment for value, etc., etc. Many mechanisms have been tried, but the key is the healthcare provider has to be part of the risk taking in the financial system. So far, the healthcare providers only take responsibility for the clinical outcomes. A system has to be developed where the healthcare provider also has a stake in the financing of healthcare and takes the financial risk, which at the end of the year can be either a disincentive or incentive, depending on the performance of the healthcare provider. With these 4 caveats that I mentioned, that is increased spending in healthcare, build infrastructure, including IT management services, improve the paying mechanism to providers, and work extensively on the demand side of population healthcare will go a long way in mitigating many more challenges that healthcare system may have post-COVID. Thank you.
Thank you, Dr. Shiban, for sharing your views with us. The link to listen to the full virtual meeting would be down in the description. To conclude, I would like to call out to our audience to leave a comment and let us know whether you like the podcast. Drop down a comment if you have any podcast ideas or recommendations. And for more such content on healthcare and innovation, visit InnoHEALTHmagazine.com. Stay safe. Goodbye from your host, Rohan Tandil from InnoHEALTH Magazine Studio. Thank you.